The sudden death of Kanye West's mother is casting light on some of the dangers of plastic surgery. Plastic surgeon Jen Adams did the combination tummy tuck and breast reduction on Donda West right before she died, which is raising questions about the safety of plastic surgery. While things like tummy tucks and nose jobs are generally safe, since it is a surgical procedure, of course, there are risk of complications. And even though these complications are rare, the head of the American Society of Plastic Surgeons has a warning for anyone thinking about going under the knife. Surgery is still surgery. There's always some sort of risk. Nearly, though, 11 million cosmetic surgery procedures were done in the U.S. alone last year, and that is up 7% from 2005. Joining me now to talk more about it is cosmetic surgeon Dr. Robert Yoho. Dr. Yoho, thank you so much for being here.
Thank you for letting me.
Well, see, I at first thought that you were down south in Pasadena, but you have an office here in Visalia, and I appreciate you coming on the show today.
I've spent a large part of my weekends and free time commuting to the Sierra, so this is sort of halfway to Yosemite where I rock climb.
So has this story about Donda West, I mean, it's cast a lot of light, obviously, on plastic surgery, but what do you want people to know? How dangerous is cosmetic surgery?
Well, I think the important thing to know is that the more procedures you combine, the more dangerous it is. And it's not just a little more dangerous, it gets significantly more dangerous. And I think that the addition of general anesthesia to a double procedure case makes that significantly more dangerous.
Okay, so we should maybe just do one procedure at a time if we're thinking about doing that.
And it's a fraction of the risk. And I think that if you have medical problems, it's very important to involve your primary care doctor. And if you have significant medical problems, it's always helpful to get clearance from a cardiologist.
Okay. Obviously, plastic surgery becoming very, very popular. What are the most popular procedures being done right now, the most common ones?
Liposuction is number one.
Okay.
Breasts are probably number two.
Okay.
Yeah.
Okay. And how often do you perform those kind of procedures then?
Well, almost every day.
Oh, really?
Yeah.
Okay. Do you have to have certain requirements for somebody? I mean, does somebody have to be extremely overweight to have this procedure done, you think?
One of the myths of liposuction is that only people at their normal weight can have liposuction. And this really isn't true. I would say that 80% of our women are over 175 or 180 pounds, and they can get very nice benefits.
Okay. Okay. Will that fat come back?
Now, that's the question everybody asks. We can't remove every last bit of fat.
Yeah, yeah.
And if you gain 50 pounds, I guarantee you're going to look terrible. But if you, even if you stabilize at the same weight that you were before, generally the contours look a lot better and the people are very happy with it.
And we have some before and after pictures that you've provided, and boy, oh boy, you can really see the difference. Can you explain to us what we're looking at right here?
That's an outer thigh and waist and upper hip liposuction procedure.
And so what does she, because I look at her and it looks like she even got kind of a butt lift, but
well,
no.
that one's not a, we do a Brazilian butt lift, which is a fat transplant to the butt. But that one didn't need it because she had a very nice butt to begin with, and we just removed the areas around it that didn't look so good. So,
and that's a pretty common problem for women, isn't it? The what do you call it right here? The hips?
Right. Okay. Outer thigh, yeah.
Okay. And the recovery after surgery like that, doctor?
Well, complete true surgical recovery is 4 months, but they really do very well after a few weeks, and they're back to work in 3 to 5 days.
Okay. So we have another picture, and if we can take a look at that, that's pretty significant too, and proves the point that men are also getting procedures done.
Well, the men do very well. They're about 15% of the total.
No kidding.
Yes.
Wow. And he just got a tummy tuck here, or what is it that he got? A liposuction?
A tummy tuck.
What is the difference?
This is just liposuction. A tummy tuck is a major surgical procedure which carries a significant risk of problems. And liposuction is viewed as a much more minor procedure.
Oh, okay. Okay, so there's a big difference there.
There's a big difference.
Okay.
A tummy tuck often involves a 2-foot scar from hip to hip, and many times I think many of the tummy tucks could be performed with liposuction. It's a balance. It's a risk. It's a trade-off. And with a tummy tuck, you get a scar and you get tight skin, but you get a significantly larger risk, and you often can get a very tight skin result with liposuction like you saw in the photograph.
Okay. Okay. A lot of the times, because women, when they have their babies and their tummies kind of get loose and they've been nursing, you know what I'm talking about, right, Doctor?
Sure.
Do you get those kind of patients as well? And do you recommend that we have all our babies before we have this procedure done, or can we do it in between?
Well, you can certainly do it in between. Traditionally, tummy tucks are done after you've had all your babies because some of the times the muscle layers are tightened, and so that in a tummy tuck. But certainly liposuction can be done, you know, in between.
Okay. And how about a breast implant?
Well, women do breast implants for their own reasons, and they have their own time when they want the breast implant. And so there's two groups of women who do breast implants. One, the younger ones that before they've had their families, and then the older ones who've had breastfeeding and their breasts have deflated a little bit, and sometimes they even need a little breast lift.
Now, I've heard that once a woman gets a breast implant, not only does she have physical changes, but there are also changes going around in her life as well. Have you noticed that? I mean, I've heard cases of many women, I don't know, getting divorced, finding new boyfriends. How does it change not only their physical appearance, but also their emotional stance?
Well, in our consultation, we have them sign a contract, and it says they must use these breasts for good and not for evil. No, just kidding. I'm just kidding. But no, we see a lot of changes, and we see the changes are everything from you know, the husbands and the boyfriends coming in and just doting on us to
they love it, I'm sure.
Yeah, or to the husband and boyfriends being replaced with a new husband and boyfriend.
Oh, that's not a good.
Yeah.
That would be for the evil
it's
part.
It's none of my business.
You just perform the surgery.
That's right.
Now, how often are you here in Visalia? How often are you down south?
Right now, we're here once a week for a day, and we'd like to increase it. We like Visalia, and I sure love Yosemite.
Oh, isn't it beautiful?
Yeah.
Isn't it now, do you find that a lot of patients are going down south to get work done just because maybe they don't know that you're here, or maybe because we hear so much about plastic surgery in LA and Hollywood that we think all the great doctors are there in that area?
Well, people like to stay local, and that's the funniest thing. They really don't like to. I mean, my market is all of Los Angeles, but the people up here seem to like the fact that I'm here, and they like the fact that I can follow them up and I can do the procedures here.
Oh, that's always in case something goes wrong.
Yeah.
Now, what kind of questions do you think you should ask your plastic surgeon? With the most important question you should ask the plastic surgeon before you undergo this procedure? And if someone wants to check on the doctor, I mean, do you recommend that they look to see what they're getting into with the doctor?
The most important question is how much experience do they have? And we've done about 7,000 liposuctions, which means my shoulders and my arms are they're just about shot. But the second part was what, Alex?
Is there a way to check to make sure that your doctor is maybe board certified or anything like that? Okay.
There are several board certifying agencies. I'm board certified. I've passed my boards in cosmetic surgery, and I'm actually, interestingly, board certified in emergency medicine, which gives my patients an additional safety factor.
Oh, yeah.
Now, you can check on the web about any doctor. There are a bunch of sites that purport to review doctors, but the information sometimes is good and sometimes isn't. And so, you know, anyone can get on those sites and say anything they want. So I would take those with a grain of salt. You can also check with the medical board.
Okay, okay. And give us the location of where you're at, or maybe a phone number in case someone wants to get hold of you, or just ask you questions, or come in for a consultation. Is that free?
Yeah, consultations are free. That's part of the Los Angeles thing, which we're bringing to Visalia. And I think the easiest way to get a hold of me is look on my website at dryoho.com, dryoho.com. And we have all our contact information there in Pasadena and in Visalia.
A final question here, just out of curiosity. Someone comes in, they're super, super thin, and you just really don't believe they need surgery. What do you tell them?
we tell them they're too good looking to be touched. That's what we tell them. We tell them we tell them we can't make them we can't improve on what they have.
Okay.
Sometimes we tell people that we think are psychologically inappropriate candidates the same thing. We can't improve on what you have.
That wouldn't be a bad
yeah.
thing to have someone tell you.
Yeah.
Okay. Dr. Yoho, it's been a pleasure talking to you. I appreciate it. Will you come back?
I'd love to come back.
All right. Sounds good. Thank you so much. Great meeting you. Coming up, one of the best ways to see the country is to hit the highway in an RV. More on a Central Valley RV show coming up next.